Hello and welcome to Getting Your Money's Worth, the show that focuses on value. I'm Judith West, and our guest today is Dr. Edward Kulich, founder of House Calls, Kids House Calls.
That's correct.
Kids House Call. Wow. Okay. The word house call, I thought that was like an oxymoron. It still exists?
It does. It does.
And that's what you do. You travel with your bag and you go and you make house calls for kids.
Absolutely.
Where did you get that idea?
Well, when I worked in Tampa, I worked in private practice.
Right.
And I would see 40 to 50 patients a day. And it was a very grueling pace. And I wasn't really providing the kind of care that I wanted to in a 10, 15-minute visit. I wanted to provide a better service for my patients. I wanted to get to know them better. And I wanted to practice medicine the way I had thought that I was going to practice when I applied to medical school, and not the way that I was told I had to when I finished residency.
I see. Where did you go to medical school?
I went to St. George's.
Yeah. And how many years have you're a pediatrician, right?
Correct.
Right. And for how many years have you practiced medicine?
I've been practicing medicine since 2004.
Oh, okay. So you're relatively new at it. Mm-hmm. You got in during the year of the change.
I did.
Tell me something. When you had your own practice, you saw healthy kids and sick kids.
Correct.
Now, with this kids' house calls that you do in New York City and the metropolitan area,
correct,
Queens, Brooklyn, you're seeing only sick kids.
Not true. I actually do well visits as well.
Oh, so people call you for house calls even when their kid is well?
Yeah.
What, like to establish a relationship?
Absolutely. If you think about it, the last place you want to bring a well child is to a doctor's office.
I know. I used to hate it. I said my kids, when we went for a visit, an annual checkup or semi-annual, they came home sick.
Yeah. And I would always, when I would have a patient come in for a physical, a couple of days later they come back with a cold, with this, with that.
The toys, the different things.
Exactly. And even if you have two separate waiting rooms, a sick waiting room and a well waiting room, eventually.
Let's go slow. So folks have an infant or they have a toddler, or whatever, and they call you and ask you to pay a house call, and they're well. Mm-hmm. And then you make a chart or whatever, you make a record, mm-hmm, and then you get called back for more wellness examinations as the child matures.
Correct.
Or you get called back if the child was. So do you then have patients that's all the medical care they get for their kids is with house calls?
Yes.
Really? So don't you need equipment, this, that, a table, a scale, a stethoscope, I get it. But do you have all that equipment with you?
Absolutely. It's all portable.
Do you wheel it? It's on a wheelie?
I have a very heavy duffel bag, in addition to my standard, Norman Rockwell black bag.
Right. And you go in all neighborhoods?
Most neighborhoods.
Yeah.
Wherever people want me to go, I'm more than happy to go.
And then does medical insurance pay for these?
It depends on the patient's plan. Some patients have very good out-of-network coverage, so they get a significant portion of the fee reimbursed. Some people don't have out-of-network coverage, unfortunately, but they see the value in the time they save, the convenience.
If they're working or something.
Exactly. So it makes sense for them.
So they pay you out of pocket?
Yeah.
Do you invoice and then collect?
No, they pay me.
You get it's COD.
That's right.
Oh wow, this is a whole new medical concept. So it's house calls for the well, mm-hmm, and it's COD.
Correct.
Oh, it's a new way of doing medical business.
I like to think so.
Right, and it's successful.
I like to think so. Yes.
Well,
I'm very happy at doing the way I practice.
So do you go by yourself?
Yes.
Do you have an office?
I have an office with very limited office hours for my very local patients that live in Brooklyn, where I'm based out of. But I keep the office hours very minimal so that I'm able to be accessible to people.
How many house calls do you make a day?
It varies.
I guess I don't know how much you have to drive.
Yeah, it could. A busy day, I can make 5, 6, 7 house calls.
So do you charge like anybody else that comes to a house? Driving time, travel time, and
I have different fees for different areas.
Right. Are your fees comparable with an office visit fee?
No, the office visit is
less.
Obviously less expensive.
But but plus travel.
Plus travel. Well, I mean, it depends on what kind of office you're going to, how much the office charges, because there's a very wide range that doctors will charge a patient, especially for tests. So if you go to an office and you have a regular checkup and it costs you, say, $100, but then your child needs a strep test, and that's another $20.
Do you do that? You do
Yes.
a strep test too?
I do strep tests.
You do immunizations?
I do.
You do everything?
I do everything.
Wow, it's a whole new. Anybody else doing this kind of thing except you?
There are several people in Manhattan that do this type of service. I believe I'm the only pediatrician,
Right.
and I don't charge an access fee. A lot of people charge access
What does
fees.
that mean?
It's more a boutique medicine where you
yeah.
pay a
Like
yearly
a retainer or something?
Exactly, but I don't do that. I like to think of myself as more of a safety net for a lot of patients, where they have their own primary care doctor and they're happy with them, but they can't get their primary care doctor to come to their house at
No, are you kidding?
2 in the morning or at 9 p.m. on a Saturday. So they know that they can get a hold of me at that particular time and they can get the care that they need without having to go to the emergency room, which is really the only option after hours in this area.
Right, exactly. Or for working parents, I mean,
Exactly.
you go in the evening, you have evening
Absolutely.
hours. You have evening hours.
Mm-hmm.
Yeah. I was Edward. So, I mean, I sort of now see how this can work. It's a very interesting concept. It's like you have an MBA and a PhD and an MD. You call yourself on your website an expert in parenting.
I like to think so.
I didn't know there was such a thing.
Well, I'm a parent and I'm a pediatrician, so someone not only with experience rearing a child, but experience with giving parents advice on how to rear their children, because that's probably one of the most important things that I do. As a pediatrician, I feel that I'm probably one of the better people to ask questions regarding parenting issues.
So you go for a house call, wellness, sick, whatever it is, and you're done with you establish a relationship with the kid, and
Mm-hmm.
you either examine for illness or examine for wellness, and you're done. And the parents say, Edward, could I get you a cup of coffee? I'd like to ask you why my kid doesn't sleep at night, or I'd like to ask you why he throws tantrums. Then do you sit down and have like a tutorial for parents, and then you charge extra for that? I mean, or does that's part of the scope of your visit?
The parents can get whatever they want from me during the house call.
Really?
And it's all included.
It's
flat rate means flat rate. The tests are included. If I have to give the child a course of antibiotics, a full course, it's all included. If they need help on training their child to sleep, if they need behavior counseling, I don't charge anything extra. I've had house calls that last for 25 minutes. I've had house calls that last for 2 hours.
Really?
It depends on the parent.
You give them a flat fee.
Yeah.
Yeah. Do you have, once you visit a client or potential patient, I suppose I should ask, for sickness, does that patient come back to you for wellness too?
Some do.
Do you turn that right?
Some do.
So you have a good track record maintaining your patient base?
I've never had an unsatisfied customer, knock on wood.
Well, knock on wood for you. So you give people their money's worth.
I certainly try.
Yeah, it's very interesting. It's very, and bad weather. I mean, you're like the postman used to be.
I do my best. If it's a 3-foot blizzard, I'm not going to be able to make it there in 10 minutes. But I really do my best. I try.
Yeah. Do you have hospital privileges?
Yes, I have hospital privileges at several hospitals in Brooklyn.
So sometimes you may say, your child needs to go to an emergency room, and I'll meet you there, or things like that.
Typically, if a child is sick enough that they need to go to the emergency room, I can usually pick it up when the patient calls me, when the parent calls me, because I don't use an answering service. The parents have my direct cell number.
People have your direct phone number?
That's my direct phone number is on the website.
Wow.
So I really
you are a unique doctor.
I see no reason why people that want to get a hold of me have to call a stranger, for the stranger to have to call me, and then for me to have to call the people back. They can get a hold of me directly. They feel more at ease talking directly with the pediatrician.
Sure.
And if they tell me my 3-week-old has a fever, And, right off the bat, there's no way I'm going to be able to handle that in the home. That needs to go to the emergency room. But if they say, well, my 3-month-old has a fever or my child has a cough, and I ask them a couple of preliminary questions and it sounds like there's something that can be handled in the home, then I'm more than happy to come out. Very, very, very rarely do I go to the home and a child actually is sick enough for me to have to send for further evaluation.
Right. So you basically eliminate a lot of the costs associated with practicing medicine now because you don't have a fancy office, you don't have a staff, you don't have a special person handling medical claims and filing these claims and collecting and blah, 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 blah. I come from the retail background. You kind of eliminated your overhead.
Yeah. Equipment is expensive, medication is expensive.
And after all, you had an expensive education.
It's very expensive. It's not, I paid $5 for all my stuff, and then
No, I get it. We're talking within a reasonable within a reasonable scope.
Right. But, the equipment does tend to run. There's maintenance on it, and there's I dispense medication, and that medication needs to be replaced, and vaccinations are very expensive. Right. So it's not. I'm not making a killing, but I'm making a reasonable living.
As you should. As you should. So do you have one of those MD cars or something you put in your car that allows you to park? You don't spend half your lifetime looking for a place to park when you go to these neighborhoods?
I try not to push my luck with parking police. Yeah. I do my best to park legally, but a parking ticket will take a good bite out of my day sometimes.
Right. So Edward, how long have you been doing this?
I've been doing this since early this summer.
Yeah, and you're happy?
I'm very happy.
Yeah, and you don't have anything. You really don't have much coming between you and your patient.
No, that's the way it should be.
Yeah. I think Americans are beginning to say in more ways than one that we understand government. We don't mind government, but we don't want government between me and my doctor.
Right.
And I suppose that's part of what you're fighting.
I'm not fighting anything. I'm stepping out of the battle.
Okay.
I just wanted to allow parents to be able to take things matters into their own hands. If they want to call the doctor and have the doctor come see their child at 9 p.m. and treat the ear infection on a weekend, then
and they're willing to pay for that.
And they're willing to pay a reasonable price, then they can get the care that they want. They don't have to trudge to an emergency room, wait 3 hours, come home with something new, and then be all over again.
Yeah, have you been to an emergency room recently?
I have. And
it's not a pretty place to go.
No, it certainly isn't.
Right. Okay. Well, I think you have a very good luck to you. I think as a retailer, I think you have a very nimble idea, and I think you're onto a good concept. And honestly, I do think that you give people value for their money because, for one thing, many people, even to go to the doctor, they have to get a babysitter for their kids. They have to get a taxi. So in many ways, you're cutting their costs too.
Yeah, exactly. Yeah. If you look at other countries, if you look at Britain, at Germany, at France, house calls are standard. They're expected. So it's a little odd that they're.
Yeah, well, that's what I said. I mean, I started out by saying this, they're an oxymoron. Maybe it's maybe this is a throwback to what was a good idea.
Yeah.
Yeah. Anyway, thanks for being on the show. We appreciate it, and good luck to you.
Thank you for having me.
I'm Judith West. You're watching Getting Your Money's Worth. We just interviewed Dr. Edward Kulich, who makes house calls for kids and gives and as a bonus gives parenting advice. Thanks for watching.